Hi, I'm Darnell Davis, and I'm going to discuss aspects of the practical applications of epidemiology. One of the things that caught my eyes early on when we first read this early in the semester were the four trends and disorders. Those four trends were disappearing, residual, persisting, and new epidemic. The disappearing disorder, basically disorders that used to be common, um, and cause a lot of death, but they're no longer due to the technology that we have or the immunizations or cures that were created over time. Residual disorders or diseases where the key factors for these disorders or diseases are known. However, control methods may not be implemented effectively, causing them to still be common. Persisting are disorders that still are common, um, and we are unable to discover or find a cure for them. And new epidemic is obviously a disorder or disease that continues to be persistent in the frequency of cases that happen over time. Um, so some of the diseases that fell into disappearing were the smallpox and polio, which is interesting because when you're younger, at least my age, when I was in elementary school, I learned about the cure of polio. So it makes sense why it would be in a disappearing trend. Residual trends, some of the things that fell into that category were sexually transmitted diseases, tobacco use, and infant mortality. Um, and that makes sense because we know of the negative effects of smoking tobacco. It says it on the box. We know that not using protection while having sexual intercourse can lead to diseases that are then contagious. Um, in the persisting category were things that make sense, like cancer, mental disorders, things that, we don't know why they happen. Why do cancerous cells form? I don't know if that's something that can be definitively answered. Mental disorders, I know it's the same thing. I have an uncle who has schizophrenia, and they couldn't explain how or why. He just, one day started to notice a change. The next thing you know, he had full blown schizophrenia that he's still currently getting care for. Um, in the last category, new epidemic, some things that fell into that were lung cancer, Alzheimer's disease, obesity, and I'm sure we can add COVID into that, even though the book didn't have that, which makes sense because we're starting to notice the effect of these disorders, COVID especially, obesity, especially amongst children, we know are big. So this caught my eye because I think if we're able to categorize different disorders and diseases into these four trends, it would allow the public and scientists and researchers to put their time or prioritize their time, basically. Obviously, if anything falls into a disappearing category, less time and resources can be spent on that. Now, of course, we don't want it to come back like how our book says there's a resurgence of the measles as of 2019. So we can't forget about them, but less resources can go to those type of diseases, and we can focus more on the persisting um, diseases like cancer. We still need to figure out what's the cause of cancer, how can we cure cancers, things of that nature. Um, Also, we could put more resources to these new epidemic disorders. For example, COVID. I know long COVID is now a thing that we have to be aware of. And okay, what are the effects of it? How can it change how you live your life? So again, just knowing what categories these disorders falls in, I think can really help just organize the efforts of those trying to fight these disorders and eventually find cures for them. Thank you.